Chuck, let me start with you. Final piece of advice for your CIO colleagues grappling with this challenge.
Yeah, so I think we touched on, almost all the various challenges. The one thing we didn't do was on the implementation side. And I've been involved in a few big implementations with like an Epic EHR and things like that. And what typically occurs in these big implementations is that archiving becomes an afterthought because you're so busy on implementing, a huge EHR, or in the case of like an ERP. And there's a lot of organizations now starting to do a lot of that. I think most everybody has an EHR now, but think about it from an ERP perspective. You're about to do a big implementation. Make sure your archiving strategy is embedded in that ERP implementation. So day one of ERP implementation, for example, is the day one of your archiving implementation. So when you get to the end and you go live, you've already figured out where the data, how much you're converting, but where the rest of it is going to be using your archiving partner. So that allows you to get your ROI a lot faster, because now you can give that 60, 90-day notice, right after go live, as opposed to a year or 2 years down the road, right? So that would be my one recommendation.
Perfect. Saad?
So, one thing that was a aha moment for me was at one of the last conferences that was in person. Somebody mentioned, hey, what do you guys do from a data governance perspective when after keeping a patient's data, X amount of time after they have passed away? So do you have rules around what happens and how you archive data for long-standing records that are no longer going to be updated ever? And that got me thinking, in the past decade, majority of the United States healthcare organizations have gotten an EHR, right? So we went through the meaningful use, and they have been on these EHRs, majority of them, for about a decade. Age of consent plus 3 years being 21 years, probably in another decade, we are going to see a lot of organizations scrambling to figure out their data governance and archiving policies. Because at that point in time, they're going to start asking themselves that very question. Organizations at large have not been on EHRs long enough to grapple with terabytes, petabytes of data of patients that have passed away. And then you don't know what to do with that data later on and how to actually get rid of it or archive it in such a way it's not taking up active space. So my advice right now is that maybe we should start thinking about those detail things today instead of waiting for another decade and then making that another buzzword with another sprouting of companies and vendors around it.
Very good. All right.